Okay, so one of the common questions we get is, where does the bone come from for the bone grafting? So in most cases, we use bone from a tissue bank, and this is what the bone looks like. You can see it's a powdered mineral part of the human bone that's processed specifically for these types of procedures. The bone graft is sterile, and there is no risk of transmission of any type of bacteria or virus or anything like that to the patient. So we don't need to take bone from any part of your body to use for this procedure. So I'm going to show on this model, so we have obviously 3 missing teeth. So let's say that tooth is removed, and you can see inside is where the roots of the tooth used to occupy the jawbone. So what we do in this case is we use the bone graft material like I described, and we hydrate this bone graft material with either sterile saline, or in most cases we use platelet rich plasma, or PRP, that we get from the patient. So we usually draw a couple of small vials of blood from the patient and process it so that we get the PRP. PRP has a lot of growth factors in it, and it's shown to accelerate wound healing in these cases. So the bone is hydrated with the PRP. I'm going to remove a little bit of the excess liquid now. And you can see it forms like this putty type of material. And then once the area is completely cleaned, we take this material and start to gently pack it into the socket. Okay, and we want to make sure that it's filling every little nook and cranny of that area. Okay, so the bone graft material is placed into the area, just like that. And then we usually use a collagen membrane or some sort of barrier on top of the graft, so it keeps the graft in place and keeps it from coming out of the socket. And then we place a couple of stitches over this whole area, and what that does is also protects the site, and it keeps the membrane and the bone graft material from coming out. So what happens is, over a period of 3 to 4 months, your own body starts to grow into this bone graft material, and it eventually turns it over into your own bone.